Hello all, we will see one of the most important reflexes in a child. See, the following sign is positive in the given image. The reflex can be identified as. See, they are fanning the toes, so it is upwards. So this reflex is Babinski plantar spindle and tendon. This is a classical sign of Babinski's reflex. Now we will see more about it. So this Babinski reflex is, so once in a child, if you stroke the sole of the foot, okay, from toe towards heel, so this is your heel portion and this is your toe portion, from toe to heel, if you stroke, the normal response of a child would be toes will fan out, okay, toes will fan out and curl as foot twists in. So I'm going to show you the image. See, toes, normal plantar response is this one, okay, toes down flexion, but in Babinski you have fanning of toes. Now we will see a little deeper into it. So this response, this Babinski was first described by Babinski in the year 1896. Okay, so this, what it does is it tests the integrity of CST. CST is corticospinal tract. So fibers from your corticospinal tract will synapse with your alpha motor neuron in the spinal cord, and it will help in the direct motor function. So this is considered, the CST is considered as an upper motor neuron and the alpha motor is considered as a lower motor neuron. Okay, so anywhere, damage anywhere along the CST can result in the presence of a Babinski sign. Okay, so if you stimulate the lateral plantar aspect of a foot, normally leads to plantar flexion due to your S1 myotomy. Okay, so the nociceptive input travels up the tibial and sciatic nerve to the S1 region and synapse with your anterior horn cells. So what happens is the plantar flexion is mediated through S1 and tibial nerve. This toes will curl down and inward. Sometimes there is no response to stimulation. It's called a neutral response. This, if you have a neutral response, it does not rule out any pathology. Okay, so Babinski sign occurs when your stimulation of your lateral plantar aspect of a foot leads to extension or upward movement of your hallux, that is your big toe. There may be fanning of the other toes as well. So in infants with your corticospinal tract, which is not fully myelinated, the presence of Babinski sign in the absence of other neurological deficits is considered normal up to 24 months of age. Okay, and it is always present when a patient is asleep. Now, coming to the important points in the question. So this is your Babinski's reflex. So this is seen at birth and it disappears by 12 to 18 months of age. Usually 6 months of age is given as a leverage for any reflex. For example, if this reflex disappears by 18 months, you should wait for the child up to 24 months. If it does not persist, uh, if it's persisting till 24 months, you have some problem. You have to visit a neurologist. Okay, and this Babinski reflex should be elicited by a blunt instrument, because your sharp instrument will cause injury. So stimulation of your lateral plantar response aspect of a foot results plantar flexion of your toes. So this is your extensor plantar reflex, which is stimulated by stroking the sole of the foot, which results in the toes of the foot should fan out and foot itself should curl in. Okay, so some causes of Babinski sign would be UMN and infants under 1 year of age and comatose patient. So if you see other options in the question, there is a plantar reflex. This plantar reflex is very normal to stroking the lateral sole of the foot. Okay, so the big toe moves downwards and there is no fanning of the other toes. Spindle reflex is not at all there. When you talk of the tendon reflex, the tendon reflex is tapping the tendons like patellar tendon. It does not involve the toes to foot soaking. So coming back to the question, uh, this sign is positive where you have fanning of toes and your fanning of toes. So this is a classic Babinski's reflex. In pediatric dentistry, in first chapter, all your reflexes would be given. Majorly, you have to know when it appears and when it disappears, and what, like palmar reflex, grasp reflex, Babinski's reflex. All that is important. You will have many questions in the exam. Thank you.